terms of imaging the soft tissue in the head and neck area, for the suprahyoid neck, which is the area above the hyoid bone, i.e. from here going up, the MRI scan is the best modality to use in contrast to a CT scan, especially for the soft tissue. So I'm going to go through one section. This is a section, a typical section. Now we're going to use this section to illustrate how to present an MRI scan. To look professionally and to look structured in your approach to addressing an MRI scan. So you can be given this slide, for example, in an interview or an exam, and asked to describe it. How will you start? So for this section, we can say this is an axial MRI scan of Mr. X. It's T1 weighted, without contrast. It's through the level of the suprahyoid neck. There's a ring enhancing lesion with central low signal. Most likely diagnosis is an abscess. Differential diagnosis is branchial cyst. So you see, you've gone through systematically the MRI scan before coming to the diagnosis, although it was probably obvious from the beginning what the diagnosis was, right? An abscess in the parapharyngeal space, or this lesion in the parapharyngeal space. But you don't actually say straight away that this is a lesion in the parapharyngeal space. You have to do it in a systematic way. So let's structure what we've just done. You may have a structure in your mind, which is fine. The important thing is that you have a structure in your mind that you can go through. This is what I suggest. This is my method, PCAP, and I remember this from a PCA pump, which is used to control pain in medicine. So we use this method to try and see if we can illustrate the points I've just mentioned. So the first thing is the plane. Decide whether the scan is taken in an axial, coronal, sagittal, or oblique plane. Secondly, whether contrast is present, and we know contrast is only given in T1 weighted images. So if contrast is present, you comment on that, and you can easily find out if contrast is given by looking at the blood vessel or find some choroid plexus, if you can, and it's quite high signal. Then you mention about the anatomy. Where was the section taken? For example, you can be very broad and say suprahyoid neck, parapharyngeal space. And then you go on to the pathology, which in most cases will be really obvious, but you don't start with the pathology. So you give, say, this is high signal, low signal, and the effect on other structures, and whether more slices are needed before you can draw a conclusion.